Good day. Today, I'm going to briefly discuss the global issue, which is the consequence of not following health and safety protocols during this pandemic. Confronting the current state of our society is more difficult than ever. Everyone should be extra conscious, especially during a pandemic. We choose this issue since it is something we deal with daily. Not following the safety measures put in place by our authorities can lead to the spread of this illness. This issue is about how to maintain health and safety regulation can slow the virus spread and increase in instances. We students ask how other countries have overcome this unseen threat by imposing protocols. We demanded to discover and see the disparities in implementation and protocols among the countries indicated. Effects of not following pandemic health and safety protocols. This title is about the negative consequences of not following pandemic protocol. As student, we want to show the public that modest step can lead to big changes, and that change always starts within. This report will hopefully awaken the public to the fact that we can only solve this difficulty if we all work together and help the institution by following their protocols. To support the authorities in any way we could, we wanted to help the public with our courage and eagerness so we can defeat the invisible enemy, the COVID-19 virus, and also be freed to do our jobs.
I'm going to briefly discuss the background of the study. When it comes to implementation, a country must be strict. They should be able to make their people follow. Because this is a global issue, governments may collaborate and find solutions. The Italian government did not act promptly, that the government spent too much time on politics and not enough on pandemic management. Italy's coronavirus containment program began small and grew as the problem became apparent. These limited lockdowns aggravated the issue. The authorities' quick response could also help ease the fight. Every government should concentrate on conceptualizing to come up with a solution towards the problem. Alarming and educating the people will also assist. During the pandemic, Israelis and Palestinians worked together to stop the virus from spreading, but conditions had already degraded. Surprisingly, the coronavirus epidemic has not resulted in more cooperation or peace efforts. The virus is currently devastating Gaza and the West Bank, including East Jerusalem, where the PA counts Palestinian cases. Infections increased from a few per day in April to 2,500 per day or more by late November or early December in Palestinian territories, according to Hassan Miller, 2020. Lack of information, dissemination, and protocol execution will lead to a rapid increase in infected patients. According to the New York Times, Sweden's inhabitants and government are trusted. Several public health professionals cited trust as a major reason why the government refused to authorize a nation lockdown to flatten the curve of the coronavirus crisis. Unlike the other countries, Sweden maintains its borders open. Restaurants and bars, schools and public transportation and park visits unrestricted during the closure. During the shutdown, some salons, yoga studios, gym, and even movie theaters have remained open. Museums are closed and athletic events are postponed. Towards the end of March, the government banned the healthcare visits that basically there are no real consequences and officers can simply ask citizens to obey. Mask-wearing citizens are frequently treated as aliens according to Erdbrink Anderson.
following the COVID-19 epidemic, the Italian government enacted a series of decrees tightening restrictions inside lockdown zones, which were later expanded to cover the entire country. Normally, this method would be considered prudent, if not wise. It backfired for two reasons. It defied the virus's rapid exponential growth. One, the ground facts were unreliable forecasts of what would happen days later. Instead of containing the virus, Italy preferred monitor it. Second, the selective strategy may have helped the virus spread. Consider first closing some sections but not others. The announcement that northern Italy was closed triggered a mass exodus to southern Italy, likely spreading the infection to new locations. Israel began imposing social separation and other laws on March 11, 2020. On March 15, the number of attendees was cut to 10 and participants were urged to keep distance of 6 feet to 7 inches. On March 19, Prime Minister Benjamin Netanyahu announced a state of emergency, enforcing existing restrictions and fining violators. It was forbidden for Israelis to leave their houses. Groceries or even pharmacies and banks would remain open. On March 25 and April 21, everyone was told to cover their nose and mouth outside. In early April, when the city of Bnei Brak had approximately 1,000 coronavirus diagnoses, the cabinet voted to declare it a restricted area and banned admission and exit for 1 week. On April 8, lawmakers imposed a 3-day travel ban and required Israelis to stay 100 meters away from their homes or cedar night. Except for China, the US and the UK, Israel administered more COVID-19 vaccine doses by the end of 2020. Moreover, Israel had provided over 11.0 doses per 100 people, while Bahrain had 3.5 and Israel had 1.4. Other countries had less than one dosage per 100 people. While Israel's COVID-19 immunization deployment wasn't perfect, it was quick and successful. Many variables contributed to this early success, which can be grouped into 3 categories. Currently, there is no vaccination to prevent or cure this condition. We need long-term measures to keep disease transmission under control. Every country succeeds in keeping people apart by using the institutions and conventions currently in place. So we did things a little differently. The majority of Swedish communicable disease rules are based on voluntary acts. It clearly emphasizes that citizens must not speak sickness. This is where we started because shutting down large cities, Sweden is now illegal. Individuals or small groups of people, such as school or hotel, may be quarantined despite of this we are unable to restrict access.
Facing the current situation of our world is quite more challenging than before. Everyone should be more cautious about their safety, especially in this time of pandemic. Choosing this topic is a thing for our group since this is the thing that we are facing every day. Seeing people die has been never tragic as this, and neglecting the safety measures that our government or authorities implementing can be cause of the widespread of this virus. This topic is all about how does following health and safety protocol helps lessen the spread of the virus and the increase of its cases. We all know that even the smallest steps that we make can create a huge difference in our everyday life. So, following health and safety protocols will be a thing for the government because this will help lessen the widespread of this virus. Let's all together fight and be one for this challenge.
We wanted to know and see the differences in implementation of the protocols themselves among countries to be mentioned. The consequences of not following the health and safety protocols during pandemic. This title is all about what are the bad effects that could prevail when people neglect to follow the safety protocols in battling this pandemic. We want to open the eyes of the public that even when we are still students, we believe that we could make a huge change by making small steps because change will always start among ourselves. This paper will somehow open the eyes of the public that we can only overcome this challenge when we unite everyone and should work as one and support the authorities by following the protocols that are implemented. As students, we want to impart our courage and the eagerness to the public and help the authority in ways we could. In that way, we can together overcome and win this battle against the unseen enemy, the COVID-19 virus, and be free to do the things we are supposed to do.
The announcement that northern Italy was closed triggered a mass exodus to southern Italy. Likely spreading the infection to new locations, Israel began imposing social separation and other laws on March 15. The number of attendees was capped to 10 and participants were urged to keep a distance of 6 feet and 7 inches. On March 19, Prime Minister Benjamin Netanyahu announced a state of emergency, enforcing existing restriction and fining violators.
We research about the consequences of not following the health and safety protocols. During the pandemic, it is essential to understand the main aspect of this study. To know why COVID-19 cases is increasing rapidly, we use the experiences of other countries that did not take COVID-19 seriously to form a conclusion.
The ways on how Israel solved their problems about COVID-19 and for safety of the people. As of March 11, 2020, Israel began enforcing social distancing, other rules to help slow the spread of the infection. Meetings were initially limited to more than 100 people, and on March 15, that number was reduced to 10. And participants were advised to keep a distance on a 6 feet and 7 inches 2 meters. On March 19, Prime Minister Benjamin Netanyahu declared a state of emergency and said that existing restrictions would be legally enforceable and violation would be fined. Israelis were not allowed to leave their homes unless necessary. Basic services, including grocery stores, pharmacies, and banks, would remain open. As of the end of 2020, the state of Israel, with a population of 9.3 million, had administered more COVID-19 vaccine doses than all countries aside from China, the US, and the UK. All other countries had administered less than one dose per 100 population. While Israel rolled out of COVID-19 vaccination was not problem-free, its initial pace had been rapid and effective. These ways really helped to solve and to fight the unseen enemy.